Hi, everyone. Thank you so much for joining today's session. Today, we'll be discussing about rapid diagnostic test. For this session, I would like to invite Dr. Debashish Biswal, who is currently working as assistant professor in the Department of Microbiology at Amrita Hospital, Faridabad. Thank you so much, Dr. Debashish, for accepting our invitation and joining this session. The stage is all yours. Over to you.
So thank you, Brinda, and thank you, CPI, for giving me this wonderful opportunity to share my views and experience on this dynamic topic of rapid diagnostic test. So it is not changing. So what is a rapid diagnostic test? So it has been can explain by the mnemonic assured, where A stands for affordable, sensitive, specific, user-friendly, robust and rapid, giving the results within 30 minutes, equipment free, and it is deliverable at the point of care. So we have RDTs for multiple infectious disease. It can be bacterial, viral, fungal, and parasitic. Also for non-infectious disease, also we have certain kind of RDTs. So pertaining to infectious disease, we have for malaria, dengue, typhoid, leptospirosis, scrub typhus, hepatitis B and C, leishmaniasis, hepatitis A. Then for stool viruses like rotavirus, adenovirus, chikungunya, C. difficile, then certain parasites like malaria and Entaema histolytica, filaria, and so forth and so on. So how to infer from an RDT? We have two parameters. One is sensitivity and the other is specificity. Sensitivity is basically the power of a test to detect the true positive ones, and specificity is the power of a test to detect the true negative ones. So I think we have all come across this news clip of flood hitting Kerala, and around in 2018, where around 7 people were killed. So it's all about leptospirosis. So we do face certain issues in leptospira diagnosis from the point of view of culture and PCR and microscopic identification test. So for that, we do have a rapid diagnostic test for leptospira. So they are also commercially available. So it comes in the brand name of SD Leptospira slash CTK, and it detects both the antibodies IgG and IgM. We also have a card isolation test which detects a immunoglobulin, right? So you can see the lines. These lines they indicate they are the positive ones, and there is no line in the test band, so it is the negative ones. And the result will appear within 3 minutes of mixing the sample with the reagent. Now, this all comes to about scrub typhus. We do often come across the leptospira scrub typhus co-infection. So it is very important to also rule out the scrub typhus, and we do have a RDT for scrub typhus. So this is scrub typhus rapid card, which detects both IgM and IgG. You can see the test line. It will appear as a pink colored line. And there are various companies like InBios, Immune, and WF, which do have the commercial scrub typhus RDTs. Then typhoid RDT, there is also a typhoid RDT kit, which is used for the diagnosis of enteric fever. So this typhoid RDT detects the IgM antibodies against the O9 antigen. It is a semi-quantitative immunomagnetic binding inhibition assay, and it is used on serum, urine, and also culture isolate, right? And the positivity is taken for a reading of more than equal to 4. It is, but yeah, it is expensive. It does not differentiate between typhoid IgG and paratyphi IgM. Then there are this immunochromatographic test based RDT for typhoid, that is known as typhoid dot. So it detects IgM and IgG, but it does not detect the paratyphi antibody. It is only for the Salmonella typhi. Then also there is another one known as enterochic WB, and it has a good sensitivity and specificity when it is compared to the blood culture. Then coming to tuberculosis RDT, there is something known as lipoarabinomannan, which is a mycobacterial antigen, which is detectable in the urine during the active TB infection. So this particular RDT for TB is based on the principle of LFA, that is a lateral flow assay, and this is available by the brand name of Alere determined TB, which detects a LAM antigen. So it requires small volume of unprocessed urine sample and it gives a result within 30 minutes. It has a higher sensitivity in HIV positive population, and the sensitivity is greatest in populations with a low CD4 count. So, medical college. Then there is also a RDT for a special bacterial pathogen known as Legionella pneumophila. So this antigen for the Legionella pneumophila, the excretion begins as early as 3 days after onset of symptoms, and it can persist up to 1 year afterwards. So there is a company by Binox now, which is available for detecting the Legionella RDT, and but yeah, this particular RDT cannot detect the infections by other serogroups of Legionella pneumophila. So this company name is known as Binax now, and the sample is urine, and it detects only the serogroup 1 soluble antigen within 15 minutes. The sensitivity and specificity is around 95%. Then coming to Streptococcus pneumoniae, again it is available in the company name of Binax now. The principle is lateral flow assay from the urine sample. Also, we can use it for CSF because it also causes meningitis. And the antigen which is used is C polysaccharide coat protein. It gives a result within 15 minutes. Sensitivity is a bit low, that is around 74%, and it has a higher specificity of around 97%. Then, as because my topic was on rapid diagnostic test in bacterial and fungal infections. So my second part will be covering the fungal infections. So we do have the RDTs for fungal infections, mainly for Aspergillus, Histoplasma, and Cryptococcus. So, sorry. So we know that this meningitis is a important cause of mortality and morbidity. And for early treatment, the sensitivity of CSA gram stain and culture is very low. It is around 50%. And the samples which can be tested with this with this latest solution test are CSF sample, positive blood culture, and also for from the colony isolate. It gives a result within 20 minutes. We just have to add the sample and then the respective antigen. Then we have to rotate it manually, and then we have to see for the clumps. So these are the bacteria which are commonly detected by the lattice salutation test. That is Neisseria meningitis group B, E. coli K1 antigen, Haemophilus influenzae type B, Streptococcus pneumoniae, group B Streptococcus, that is A. galactis Streptococcus, then Neisseria meningitis A, C, Y, and W135. So you can see the sensitivity and specificity is almost 100% from the CSF sample, with exception of Haemophilus influenzae type B, where the sensitivity is around 97, and for Streptococcus pneumoniae it is around 91%. Then there is also a commercially available rapid test for anti-streptolysin O, right? So basically, what is streptolysin O? It is a hemolysin which is produced by group A beta hemolytic streptococci, and the cutoff which we take is above 200 units per ml. So any rise in ASO, anti-ASO titer above 200 units per ml is associated with a recent streptococcal infection. So how does this the kit works here? What is the principle of this test? That we do use latest particles which is coated with the streptolysin O antigen. Then we mix the patient serum, and if it contains the antibodies, the antigen antibody will bind and they will cause a reaction and they will cause a agglutination. And this result is, it delivers a result within 2 minutes. Limitations, this kit has certain limitations like false positivity is observed if you take the reading after 2 minutes due to drying effect, due to certain factors like rheumatoid arthritis, scarlet fever, tonsillitis, and also in healthy carriers. False negative. Sorry. False negatives are seen in case of early infections and in children between 6 months to 2 years. Now, the rise in ASO titer may be suppressed in certain conditions like elevated serum beta lipoprotein and cholesterol, and when the patient is on penicillin or other antibiotic therapy. Then in fungal infections, like Aspergillus is a very one of the important fungal pathogen causing infections in humans. So we do have fungal RDT in the name of LD Bio. So it gives a result within 30 minutes. It is based on lateral flow assay, and it detects both IgG and IgM class of antibodies against the Aspergillus fungi. And yeah, it is easy to perform and simple for interpretation. And for proven chronic pulmonary aspergillosis, sensitivity is around 91 and specificity is around 98%. And also it is very useful for detection of allergic bronchopulmonary aspergillosis. Limitations, uh, like low or undetectable aspergillus IgG antibodies can be found in several minor immunological defects. Histoplasma, here the antigen can be detected by RDT method in the urine sample. So it is basically based on the sandwich engine immunoassay principle, where we use a rabbit monoclonal antibody for the detection of the histoplasma galactomannan antigen in the urine. So the antigen which we use for detection of histoplasma is the galactomannan antigen, and the result is obtained within 90 minutes. It's around 1.5 hours. So you can see here is the kit. So you have to open the card, then you have to dip the swab in the sample and then add the swab to the card, wait for 30 seconds, then add a reagent A and then close the card and wait for 15 minutes, right? The sensitivity is very good, around 96% and specificity of around 89%. Cryptococcus is one of the agents which causes meningitis. So for that, we do have a lattice salutation test. So it gives a result within 10 minutes. You can see there is a clumping of the antigen antibody complexes. Specificity and sensitivity both around 100%. Advantages is that the protease effectively reduces the rheumatoid factor reactions. But yes, there are certain disadvantages where we do find phosphocytic reactions due to infection with Trichosporin vageli, where the antigen do cross-react with the antigens of Cryptococcus neoformans capsular polysaccharide. So with this, I would like to conclude my presentations on rapid diagnostics of bacterial and fungal infections. Thank you.
Thank you so much, Dr. Devashish, for that very quick and informative session. Just few points that I wanted to discuss with you. One is regarding, are these rapid diagnostic tests easily available when it comes to public sector, like primary care centers, or are these tests mostly available only in the tertiary centers?
If you speak about the primary health centers in PHCs where like you cater to a population of around 80,000 and the infection is mostly caused by malaria, dengue, leptospira, scrub typhus, depending on the geographic location, and also chikungunya. Yes, in PHC we do have malaria ICT, we have filaria ICT, we do have scrub typhus ICT, and then yes, we do have also dengue ICT and but not chikungunya. So most commonly
Okay,
malaria, filaria,
dengue.
scrub typhus, and dengue.
Okay. And are these tests very costly, or is that quite accessible to the public? Like, how would you say about the cost? Because I think in one of these slides you mentioned that it is quite expensive. I think when you talked about the typhoid RDTs, was it
Yeah,
where you're
yeah.
talking it could be expensive?
The one which we use, that is a Typhi dot, that is cheaper. But the
Okay.
one like which is also used by some kind of reference lab, that is a bit costlier. But yes, there are when the disease is covered by the Ministry of Health and Family Welfare, like National Vector-Borne Disease Control Program, yeah, National Malaria Control Program, in all these programs, the RDTs are supplied free of cost to the respective PHCs, CHCs, even district headquarter hospitals. So there, like it is very, very cheaper. Even like it is
Okay.
given free of cost. But when you work in private sectors, in corporate sectors, yes, they have to pay.
Okay. And these rapid diagnostic tests that you talked about in the fungal infections, are they commonly used now, or compared to the bacterial infections or the
Yes. For fungal infections, almost every lab uses for cryptococcus, because that is one of the main
okay.
causes of meningitis, especially in immunocompromised patient HIV/AIDS. So we do use for cryptococcus rapid diagnostic test. And yes, tertiary care centers do have also aspergillus, IgM and IgG antibodies rapid diagnostic test, and also yes, histoplasma, where you find high prevalence of histoplasma mainly along the the Ganga River basin. All those
Mhm.
states which come under the Ganga River basin, there almost every hospital medical college has the histoplasma urinary antigen rapid diagnostic kit.
Okay. Right. Thank you so much. That's all with the discussion. Thank you for accepting our invitation and doing this presentation.
My pleasure. Most welcome. Most welcome. Thank you.